My name's Elaine Chambers, and I was in Queen Alexandra's Royal Army Nursing Corps. Joined in 1982 and I served until 1988. I started training in 1982. The first 6 weeks was all the military side of things, so no nursing at all. That was all drill and PE and learning about the history of the Corps, warfare, etc. and so forth. And then after 6 weeks and after the passing out parade, then the actual nurse training started. And I had 6 weeks introduction to nursing at the Queen Elizabeth Military Hospital in Woolwich. And that was to start the really basic things like learning your way around a sluice and making beds with hospital corners, temperatures, blood pressures, bed baths, the real simple starting point. And then after the 6 weeks of that introduction to nursing, we then really set to with the 3 years training. And the first 18 months was in Rintel in Germany. And the second 18 months came back after 18 months to the Cambridge Military Hospital in Aldershot. And the training was, it's quite different really, I think, to what goes on now. It was what was called modular training. So it preceded Project 2000. So it was very practically based. And you basically, the modules were each place that you went to, each placement, so whether it be surgical, maternity, psychiatry, medical, anything or other, whichever ward you went on, you had 1 or 2 weeks in school of nursing first. So that would be with the tutors guiding you through the kind of things you might encounter, the kind of typical conditions that patients might have that you'd be looking after, and just preparing you for going on to the wards. Then when you were on the ward, you were always buddied up with somebody to guide you through. So usually a trained nurse, either an SEN, so state enrolled nurse, or SRN, state registered nurse. And you would then spend your time on the ward. You would always have one practical element to complete during your time on the ward. Most wards you did an 8-week placement, but it did vary. And then you also had to do a written care study to present at the end of your time on the ward. And then what you would do is at the end, the next part of the module would you go back into school to have a consolidation block to consolidate everything you'd learned whilst in the ward and to go through your care studies and to sort of look at anything you might need to review. And then you'd be preparing for your next module, and it would go on like that for the 3 years. The reason I chose the army is actually quite prosaic, really. I originally applied to join the army to train to be a driver, and I accidentally sort of fell into nursing because basically was told by the recruiting sergeant at Whitehall, Central London Recruiting Depot, oh, everyone who joins the army wants to be a driver. You've got A levels. Why don't you join the QAs instead? And I was like, what's the QAs? I'd never even heard of the QAs, and nursing had never been in my orbit. So I actually joined kind of as an accident. And yeah, it was a lucky accident, but it was never my intention from childhood to be a nurse. And there was no nursing history in my family whatsoever. So it was just a happy fate, I suppose one might call it. And the training, well, the military nursing training, although at the end of the 3 years we did the same exam as NHS trained nurses would do, the vast majority of the training was in military hospitals. So it wasn't alongside other nurses apart from certain specialisms. So, but two interesting things. The military hospital in Aldershot, for example, 70% of our patients were civilian. So we weren't only looking after military personnel, but we did do some training alongside civilian nurses, and that was in geriatrics, because obviously the only sort of older patients we would normally have, because of most people finishing their military career at the age of 55, would probably be visiting friends or family who might have fallen ill. So we had to do our geriatrics in civilian environment. So I did mine at Hyde Style in Godalming in Surrey. And then the other one that we worked alongside civilians was psychiatry. Again, because military P wings, as they were called, which is psychiatric wings or units, tended not to have a great variety of psychiatric conditions represented by the patients. It often tended to be, there would often be the same sort of conditions, and it was fairly limited because of the nature of our patients' problems mentally. So I did 8 weeks psychiatry at Park Pruitt at Basingstoke. But other than that, it was all in military hospitals. Joining the army in itself, I was very proud just to make it, really. And passing out parade was phenomenal. It's an intensely proud moment. But yeah, the whole of my training I thoroughly enjoyed. I really loved it. It was an interesting time to train as well, because it's in the middle of the Cold War. So being out in Germany and understanding that I might have to perhaps nurse enemy patients and prioritize the care of the patient over any political or geopolitical leanings we might have was kind of interesting. But no, the whole experience for me was fantastic. And then after I'd qualified, when I applied for a commission and was commissioned quite soon after qualifying, that was enormously proud as well. I just felt a real sense of achievement, and I knew what I wanted to do, and I'd made up my mind I wanted to go on to do midwifery training. That was going to be my specialism. So yeah, it was the whole experience was just superb, and I made great friends. I'm still in touch with them all now, and yeah, absolutely no regrets whatsoever. It was wonderful. In Germany, although I was out there during the Cold War, I was never involved in any actual sort of conflict situations. We would practice for wartime nursing, sort of nursing in tented hospitals, when we'd have MASH exercises, so mobile army surgical hospitals. So you'd have mini MASH and maxi MASH exercises, where you would set up as if you were behind the front lines in a conflict situation, and you'd have various people acting the role of injured soldiers, potentially also perhaps injured in a nuclear, biological, chemical warfare situation, which was quite difficult because it involved then attempting to nurse people in full NBC kit, including gas mask and gloves and overboots. So yeah, that was something. When you're young and you've signed up, perhaps because you've signed up because you know it will be a good life and an interesting place to work and an excellent training. But when you're quite young and you're actually thinking about what this might mean in reality, if there was an attack and you were having to nurse the enemy, is quite thought-provoking. But we were very much taught, in the same way as any nurse would have been, that you prioritize the patient's healthcare needs over anything else. And of course we would have done that, but we were never actually called upon to do it, or I wasn't. I know friends and colleagues who have nursed in those situations, but I didn't. So for me, the best thing about being an army nurse, and I particularly was aware of this after I left the army, was just how brilliant the training had been and how incredibly well staffed military hospitals were at that time. There were a lot of military hospitals then, all around the world, and not only were some of them just fantastic buildings, like grade 1 listed buildings, but it was just the sheer numbers that we had on each ward. We were very, very well staffed. We had regular team members for every aspect of the ward, so you'd have a cleaner that was part of your ward and part of your team, so there was a real sense of pride in looking after the ward and the patients as well as you possibly could. And just even doing our work, looking back, I realized how lucky we were. So if you were, say you were allocated, if you're on a surgical ward and you were allocated to do all of the wound dressings that day, you would always be in pairs. So one of you would be doing the main dressings, so doing all the aseptic techniques, but you'd have someone with you that was called the dirty nurse, and not because an aspersion on their hygiene or anything, but basically the dirty nurse was there to help you. So if you needed anything doing, so while you're all ready and you've got your gloves on and you're working with your forceps and not touching things, etc. and so forth, if you need something new, you just ask the dirty nurse, oh, could I have some more gauze swabs? Oh, could you put in some more Hibisol in there? And so it made it much more efficient and much quicker, but also totally clean, hygienic, professional. And we, looking back, you know, we never had hospital acquired infections in those days. We just didn't. If someone came in from outside, they might have something infection wise, but we just didn't get them because the wards were spotlessly clean. And yeah, we were incredibly well trained, looking back with the wisdom of hindsight, especially when I've subsequently worked in different arenas other than where I was trained. I just realized I'm immensely lucky to have trained when I did. The other side I would say about the training that I think is really, really good, and yes, I'm at risk of sounding like one of those old people who go, oh, when I was a lass, it was so much better. But I do honestly believe there's a little too much emphasis now on academic elements of nursing and less on clinical skills. And I think they need to strike a balance and go back a little bit to the way we did it, because I think the modular training was just such a good balance between the two. The only really bad or downside to nursing in the military at the time that I did was that at the same time as I was a young staff nurse and then a young sister, building on my clinical skills and my knowledge and my awareness and sort of developing professionally, I was also discovering my sexuality. And at that time, anything other than heterosexuality was unacceptable to the military. It was you were deemed criminal if you even thought that you might be gay. And unfortunately for me, gossip and rumour led to my being investigated by the Royal Military Police. And although no actual sort of charges were made against me, they had enough information or evidence that I might be gay or might have gay tendencies, and therefore had to leave and was deemed no longer fit to nurse in the QAs, which was patently not true. But that was sadly why my career ended very quickly and shockingly and devastatingly, to be honest. It was awful. So after I left, I went back to the UK, back to my family home. Luckily, Mum and Dad were happy to have me back. And once I'd sort of realised that if I've lost my career because I'm gay, that I need to accept that in myself and stop fighting it and stop trying, you know, really hard not to be. I then recognised how ridiculous it was to have lost a brilliant career because of who I am, and it was so patently unfair and bigoted and ridiculous. And fate led me to meet a chap who'd lost his army career, and we met up and we were invited to take part in a documentary. And as a result of all of that, we decided something needed to be done, because it was quite obvious that most people didn't even know that there was a ban on being gay across the military, not just the army. So we co-founded an organisation that we called Rank Outsiders. And initially its prime aim was to try to be a support group, really, to try and help if there was anybody currently serving that wanted some unbiased, proper advice, to try to help them, but also to support each other. And then to start campaigning against the ban and to try ultimately to get it lifted, because we could just realise how ridiculous it was. And then it became very quickly apparent that there were hundreds or possibly even thousands of servicemen and women whose careers had been ruined by this ban. So we set up Rank Outsiders in 1991. And then in 1994 or 5, one of our members set up the Armed Forces Legal Challenge Group. And that basically led towards the lifting of the ban, which was lifted on the 12th of January 2000. And Yeah, I was very, very proud of everything that we set the ball rolling really in Rank Outsiders, and at our height, I think we had over 3,000 members at the height of our sort of success. And bearing in mind that was all pre-social media era as well. There were no emails or websites then, so we did it all through magazines, gay press, going on the TV, radio, speaking to newspapers, writing letters, and just creating this membership network. And then we got a telephone helpline established with the help of Stonewall. So we were able to help people, and yeah, so we undoubtedly, the ban was lifted sooner than it would have been without our input, and we know we definitely helped. Well, it sounds melodramatic, but we have helped save some lives. So yeah, very, very proud of that. Since the ban was lifted and things have moved on, there's another book was written, and that was some stories gathered by Craig Jones, who was a Royal Navy commander, and the book was called Fighting with Pride. And then on the back of that, he and others have created a charity of the same name, with the aim of really supporting LGBT plus veterans whose lives were negatively impacted by the ban. And they've been absolutely superb, not only in the way that they're supporting people with, well, just there is the support element, but they've also do things for people. So they give you opportunities to go away, to go on trips, to have counselling, to really look at things. But they've also pushed for there's a current independent review being undertaken by Lord Etherton to try to get the government to address the iniquities that were not adequately addressed in the past. And things have just moved on so well since the ban was lifted, and no one's saying it's perfect now, but the armed forces now are amongst one of the better employers to work for in terms of diversity and inclusion. And the world didn't implode like lots of people used to threaten it would, and that everyone would leave if they were forced to work with gay people in the military. It just didn't happen. And things are just so much better now. It's a bit weird for me when I sometimes hear, I've met QAs, and that's interesting for me too anyway, nothing to do with the LGBT side, that there are now male QAs, as there should have been. We had male nurses in our group, but they were then part of the Royal Army Medical Corps, the same corps as the doctors, instead of in the nursing corps. So now we have men in the QAs. So that already is funny for me when I see these male QAs. But when I talk to new QAs now who are serving, who are LGBTQ, and they say, some of them, we didn't even know there was a ban. And I'm just like, oh my gosh, it's a bit weird for me. It's lovely because you're like, that's great. They didn't even know. And that's partly because of what we did, that it's now acceptable and they can be themselves, and that does not impact on their day-to-day life and their ability to have a full and brilliant career in the army, for example. But in another part of me, it's sort of like, oh, you need to know what went on in the past. So I usually put them right on that one. After I left the army, one good thing of it all was, having been trained in the army, my skills were massively in demand. Back then in the 80s, just as it is now, huge shortages of nurses all over the world. So I had done some really mixed and interesting experiences. I started off working in the NHS for the first time in my life, and that was mainly around Harrow, which is where I was from and where I went back to live with my mum and dad, and doing a lot of agency nursing. And oh, what a shock that was. Oh my goodness, to go from having been so well staffed with these fabulous, just great hospitals, to these manic wards, understaffed, terrible workloads, was quite a shock, to say the least. I've nursed in France for a while, and in Switzerland in the private sector, which was quite a shock also. Very different to what I was used to. Switzerland, it was a university teaching hospital in Lausanne, beautifully appointed and very, very well funded, but for me personally, ethically immoral. the way in which they were looking after people and making sure that they were charging them for all manner of things that they probably didn't actually need, which I felt was quite shocking. I can't really go into that now. I could, but it would take too long to explain it all. But it was pretty shocking to me. And yeah, for France, oh, this private hospital, yeah, awful. I loved being in France, but the workload was huge, and most of the nurses there was so stressed and so burnt out because the workload was massive. And you know, the whole thing about profit seeking was quite a shock to me. Since then, yeah, the main nursing I've done since then, much more to my liking. I did 9 years at the hospice on the Isle of Wight as a Band 6 senior staff nurse, and I loved palliative care. I was also briefly a Marie Curie associate nurse before I came to the Isle of Wight, and I love palliative care. Found it very rewarding, and being able to really spend time looking after your patients was not dissimilar to what I'd experienced in the army. So that was really good. But yeah, NHS nursing I found difficult because it was just much tougher, and the workload was much heavier than what I'd been used to. Agency nursing was hard too because you know, there was a lot of resentment because regular nurses knew that you were being paid more as an agency nurse, but you certainly earned your money as an agency nurse, and you had to be very adaptable, moving around to different wards all the time. And then you'd soon, as soon as people realised you were a good nurse and very conscientious and professional and knowledgeable, you'd get booked on regularly to come back to certain wards because they liked you and say, we don't mind, just bring her back, she knows what she's doing. So it was a mixed bag, nursing, after I left. But and I also worked in nursing homes. I worked in a couple of nursing homes, one of which was fantastic, a very small nursing home in Beckenham, which I really liked, which was a private nursing home. And funnily enough, I worked for a big nursing home in Harrow for a brief while, and that was run by what was at the time the second largest private company, private provider of healthcare in the UK. This was in the 90s, and it was awful. So it was quite interesting. I've found some interesting experiences working all different areas of nursing. I think for me, when I think about somebody like Florence Nightingale or Mary Seacole, obviously there's the big thing about finally sort of treating military personnel as real people and a much more sort of caring and holistic approach to them. And I think that's just carried forward now, just the real basic premise of, you know, you're not looking after the appendix in bed 3, or, you know, this is a person. It's not just the condition, it's not just the you know, the injury or the illness. So I think that's a massive legacy. But I also, thinking about it, I think the other really important thing that they did, whether it was intentionally or not, is they absolutely in many ways paved the way to sort of independence for women, because in professionalizing nursing and moving it away from the sort of Sari Gamp, you know, drunken, you know, midwife imagery, I think that was really important because it gave women some options, instead of just being forced to make sure they made the best marriage they possibly could to give them some status in life, you know, particularly when you consider the era that this all came about, before women even had the vote. So yeah, I think the legacy is huge, and not just in nursing terms really, but in feminism terms. So I did write a book about what happened to me in the military, and although a lot of the emphasis is on the ban, there is a fair bit of mention about what it was like nursing in Cold War Germany, and you know, how we looked after one another. So if anyone is interested in reading in more detail about what it was like and what happened, it's called This Queer Angel, and it's still available, I believe, on Amazon, and you can get it from bookshops.